I think it's really important for Lancaster University Management School to have a focus on healthcare and healthcare issues.
In contemporary society today, we are facing significant challenges with regard to inactivity in the workplace.
If you think about the important factors in society, we want people in our country to be happy. What determines their happiness? Well, the most important factor is their physical and mental health.
Ensuring healthy lives and promoting well-being is a key global sustainable development goal. This is a central concern for us in LUMS, and we work closely with local health organisations and with other parts of the university to deliver and respond to the needs of our location.
Health is something that has always been important for the management school, and it's an opportunity for us to work with our other faculties in the university, particularly health and medicine.
Research potentially has an enormous impact in shaping practice in organisations like hospitals, mental health institutions, even ambulance services, community health services, because we can provide evidence in very uncertain times about what makes a difference. Our research has shown that what predicts the performance of healthcare organisations is levels of staff engagement, the extent of compassionate leadership, quality of team working, inclusion, and also high levels of morale and low levels of burnout and stress. Well, those kind of research findings can inform policymakers about how they can make the changes they need to make to ensure our health services are delivering for the people of our country.
It's important to work closely with these organisations to really understand, often through very particular instances and examples, where the obstacles lie. We can talk in broad terms about SMEs being short of time and short of resources and very different to the NHS, which is big, maybe bureaucratic and slow to change, but we need to understand exactly how that plays out in practice in particular instances. What stops the SME being able to get an interview with the procurement manager at the NHS or whatever it might be. So only by working closely with the firms and with the NHS colleagues can we really understand how that obstacle really plays out in process, what form it takes. Our work on that process of the SMEs engaging with the NHS through the Health Innovation Network, this kind of intermediary organisation, has really allowed us to report to them, the Health Innovation Network, what we think works, what we saw happening in the processes that they support and facilitate, and we hopefully can tell them some things from an outside neutral perspective which may help them improve that function in future and help those SMEs, more of those SMEs, connect effectively to the NHS.
MIA is the project on measures for improved access to medicines and vaccines, and the main focus is providing an evidence base for dealing with shortages in medicine supply chains. It's also focused on bringing together different stakeholder groups outside of the traditional supply chain so that they can work together to tackle these challenges. MIA is an important research topic because medicines are part of all our lives, regardless of whatever age. At some point, we will typically have some interaction with medicines, and they have a host of functions from giving us comfort to helping us treat life-threatening conditions. So being able to improve the supply means being able to improve the quality of lives of individuals around the world.
Our research addresses a very important problem, which is the limited availability of drugs that patients need for their treatment and well-being more generally. It is a big issue internationally, with recent examples of medicines going short being antibiotics, oncology drugs, and ADHD medication. Lancaster is part of the MIA International project, which seeks to identify and evidence cost-effective measures to reduce medicine shortages and improve the resilience of medicine supply chains. We have engaged with major stakeholders in the UK, including the Department of Health and Social Care, the NHS, industry associations and community pharmacies, to try to identify some effective solutions in this area. This is a very important issue for research, and it has the potential to generate significant impact, because obviously medicine shortages can directly impact the patients and their welfare. It can lead to delay or cancellation of care, and in some extreme scenarios it can also lead to deaths.
So the work that I'm doing in health services across the UK and internationally, in essence, is kind of focused on how do we create the conditions within health service organisations where high quality, continually improving and compassionate care will be delivered for patients. But also, how do we create the conditions where we are providing high quality, compassionate support for staff, because those two things go together. I think it's enormously important to engage with large organisations like those that constitute the NHS. I mean, when you think about it, the NHS is the largest single employer in Europe, 1.4 million people employed in England. And the NHS touches everybody's lives continually throughout their lives. And I think as a university, as academics, it's part of our responsibility to support those institutions to try to make a positive difference in society.